Hello everyone. In today's video, we're going to talk about Medicare Supplement Plan G. Is Plan G the best option? So before we could even talk about a Medicare supplement, we have to understand, why do you even need a supplement plan? So first, let's talk about original Medicare, and that will help you understand why a supplement plan even exists. A Medicare supplement plan is also known as a Medigap plan, okay? So let's get started with what is original Medicare and why you need a supplement. Original Medicare has two parts of health insurance coverage. So when you're turning 65 and you worked in the U.S. 10 years, 40 quarters, then you are eligible to go ahead and enroll in Original Medicare. So there's two parts of Original Medicare. You have your Part A, which is your hospital coverage, and you have your Part B, which is your medical coverage. Original Medicare covers 80%, leaving you behind 20%. There's no cap, there's no ceiling to that 20%. So whatever your medical bills are, you're responsible for 20%. And we don't want you to go into medical debt, because 20% can be a lot of money. So this is why Medicare supplement plans were put in place, because they actually pay that full 20%, okay? So in today's video, we're going to talk about Medicare Supplement Plan G. So let's get right into it and why some say that Medicare Supplement Plan G is the best, but I'll let you make that decision for yourself. Let's get right into it. The first thing that you want to take when it comes to a Medicare Supplement Plan G, that it is comprehensive coverage, meaning that it's the most coverage that you would get when it comes to a Medicare supplement plan, right? The most comprehensive plan besides a Medicare Plan G, which is more comprehensive than Plan G, is a Medicare Supplement Plan F, because Plan F pays the full deductible for you. And we will talk about the deductible in a minute. However, you cannot enroll in a Medicare Supplement Plan F after January the 1st, 2020. You can get a Plan F if you turn 65 before January the 1st, 2020. So the next one up is going to be a Medicare Supplement Plan G, okay? And we're going to show you guys the chart on what the supplement covers as well later on in today's video, okay? The first thing you want to remember is that Plan G is the most comprehensive plan next to Plan F, and Plan F is no longer available after January the 1st, 2020 for those turning 65 after January the 1st, 2020. Now let's talk about the Part B deductible, okay? So there is a Part A deductible, which is covered by a Medicare supplement plan, and there's a Part B deductible that is not covered by a Medicare supplement plan. So this is the only deductible that you have to pay out of pocket when it comes to a Medicare supplement, right? It's about $300 or so per year for your deductible, which is pretty good. So once you pay that amount, then the supplement will kick in and pay the 20%. For an example, say in January, your doctor charges you $150 for that visit. You will pay the full $150 until you meet your annual deductible. Once your annual deductible is met for the year, then the supplement will come along and pay the 20% that Medicare leaves behind. Another factor that you want to take in place is freedom of choice. So yes, when you choose to go on a Medicare supplement plan, you can go to any doctor that takes Original Medicare. Any doctor within the U.S. that takes Original Medicare, as long as that doctor is taking new patients, you can see that doctor. So that means there's no doctor networks. So with a supplement plan, as long as that doctor takes Medicare, Original Medicare as payment, then you could go ahead and see that doctor, no doctor networks whatsoever. So you have the freedom to choose the doctor that you want to see, and that's for your primary care doctor, that's for your specialist. You don't need a referral, nothing like that whatsoever, which is really nice when it comes to a Medicare supplement plan. Another factor that you definitely want to take in place is pre-authorization. There's no pre-authorization when it comes to a Medicare supplement. If it's a service, treatment, procedure, surgery that original Medicare already provides, then the supplement will follow. So there's no one to call for pre-authorization or anything like that, which is really nice for someone that may have a pre-existing condition, a chronic condition, or such. So that is another bonus when it comes to Medicare supplement. You don't have to worry about pre-authorization. You don't have to worry about step therapy or anything like that when it comes to Part A, which is your hospital coverage, and Part B, which is your medical coverage. Another factor that you want to consider when it comes to deciding if you want a Medicare supplement plan is guaranteed renewal. So as long as you continue to make your payments every month for the Medicare supplement plan, then you don't have to worry about the insurance company kicking you off the plan because you have a chronic condition or you become ill or anything like that. So you are guaranteed to renew your plan year after year as long as you continue to make your payment. So that is a great bonus when it comes to having a Medicare supplement plan. Now, since we're talking about guaranteed renewal, let's talk about the cost of a Medicare supplement. Original Medicare, like I said, has two parts, right? You have your Medicare Part A, which is your hospital coverage, and this is what you was paying for when you was paying taxes. So most individuals will pay zero premium for Medicare Part A. Now, when it comes to Medicare Part B, which is your medical coverage, there is a monthly premium. Most individuals will pay around under $200 or so per month. If you're a higher earner, then you'll go by the IRMA chart, and it will basically list how much you would pay depending on how much your income was, your adjusted gross income in the past 2 years, okay? So you have your Part B premium. Now, with a Medicare supplement plan, it also has a premium as well. So the rates really depend on the area where you live. In the US, it could be very different. Here in Florida, the rates are a little higher because there are more seniors that retire here in Florida. So in Florida, you're looking about $400 or so per month for your Part A, your Part B. You also need a drug plan and your supplement plan as well. Other parts of the country, you're looking at about $300 or so, give and take, for the whole package, which is Part A, Part B, your supplement plan, and your drug plan. So that is the ballpark when it comes to a monthly premium for a Medicare Supplement Plan G, okay? Now, you may ask yourself, is a Medicare Supplement Plan G even worth it? And the answer is yes, absolutely yes. Let me tell you why. I gave you a few pointers already, which is you can go to any doctor. You don't have to worry about pre-authorization or step therapy. You can travel with this plan as well. You could be in New York for 6 months. You could be in Florida in 6 months. As long as the doctor takes original Medicare, they would take your supplement, okay? So if you end up with a chronic condition or cancer or any health conditions where you need to see the doctor on a regular basis and additional specialists and such, then a supplement plan is definitely a great option because you don't have to worry about, hey, can I go to this cancer center or can I go to this specialist? As long as that cancer center, and most do, and specialist takes original Medicare, then you are okay. You don't have to worry about that at all. So a Medicare supplement monthly premiums are worth it 100%, okay? Okay, so we touched base on this for a little bit, but I definitely want to talk about it. Travel. So with a Medicare Supplement Plan G, you can definitely travel with this plan, okay? Like I said, you could be in New York for 6 months, Florida in 6 months, and use your supplement. It also covers foreign travel. There are some limitations up to 80%. So it's very nice to know that you can travel with a Medicare supplement, and a lot of individuals would choose a Medicare supplement for this very reason. Peace of mind when you are traveling. Now, I do want to say, if you're on a Medicare Advantage plan, which is definitely different from a Medicare supplement, with a Medicare Advantage, you have to worry about doctor networks, pre-authorization, and such. You can use your Medicare Advantage plan in an emergency situation if you're out of state, okay? I do want to point that out. But like I said, with a Medicare supplement plan, you can have a primary care doctor in Florida. You can have a primary care doctor in New York, which is really nice because you choose where you want to get care when it comes to a Medicare supplement. Please take a moment to like this video. Give it a big thumbs up if you are enjoying the content. It really helps others to find this video, and it helps the channel a lot. Thank you so much. Moving along. Now let's talk about how do you choose the right Medicare supplement plan in the first place, right? Because this is the thing when it comes to a Medicare supplement. They're all the same. They're standardized plans, so that means that all of the plans cover the same thing, right? When it comes to Part A and your Part B coverage. So when it comes to shopping around for a Medicare supplement plan, it's very important to understand that you should work with an independent broker like myself that understands the plans in your area and understand these companies that offer these Medicare supplement plans, okay? Because you want to look at their rate history, how often have they increased their rates, and how stable is that insurance carrier in the market, okay? You definitely want to be careful when it comes to enrolling in a brand new company when it comes to a Medicare supplement plan, because usually what happens, they will start you off at a very low rate to get as many enrollees in. And if they're not stable in the market, then they can increase the rates at a point where you cannot no longer afford the rate. So it's very important to just not shop for the cheapest plan. You want to go with a company that is stable in the market, has been in the market for a long time, and have the rate history to show how much have they increased their rates over time, okay? So that's going to be very important when you shop around for a Medicare supplement company. Like I said, you want a company that is very stable in the market and have, you know, regular, steady rate increases. That is going to be key when it comes to shopping around for a Medicare supplement plan. So when is the best time to shop for a Medicare supplement? The best time is when you're first eligible to do so, turning 65. You have that 6-month window, and the reason why it's very important, because you don't have to worry about underwriting at all. So what is underwriting? Underwriting is a series of health questions, and if you say yes to any of these questions, then you would not get approved for a Medicare supplement. So if you are considering on getting a Medicare supplement plan, the best time to enroll is when you're first eligible and your 6-month window, okay? So you don't have to worry about underwriting later on in the future. For an example, say you started out with a Medicare Advantage plan and something happened, you end up with Parkinson's or dementia, you know, a very serious chronic condition, and you have decided, you know what, I want to be able to go to any doctor because of my health condition. You will have to go through underwriting. And if you say yes to any of these questions that I have mentioned, such as Parkinson's, diabetes with complications, AFib, and such, most likely you will not be able to get on that Medicare supplement plan. So it's best to get on the Medicare supplement plan when you're first eligible to do so. So I tell my clients this: look at your finances. Can you afford the Medicare Supplement Plan now and for the remaining of your life? Look at your family health history and look at your own health history as well to determine if the Medicare Supplement Plan G is the route for you. Now let's go ahead and look at the Medicare Supplement chart and show you what is actually covered. Like I said, Plan G is the most comprehensive next to Plan F. All right, so let's look at Plan G. We have Plan G highlighted here. So your Part A co-insurance and hospital coverage is covered at 100% when it comes to Plan G, up to an additional 365 days after your Medicare benefits are used up, okay? Your Part B co-insurance and co-payments are covered as well. So the first 3 pints of blood is covered at 100% when it comes to Plan G. Your Part A hospice care co-insurance and co-payments are also covered at 100% when it comes to Plan G. Skilled nursing facility and co-insurance is also covered at 100% with Plan G. Your Medicare Part A deductible, so you would not have a Part A deductible when it comes to Plan G. Now, like we said before in the video, your Medicare Part B deductible is not covered under Plan G. That is only covered with Plan F, and Plan F is no longer available. Actually, Plan F and Plan C. And we already said these plans are no longer available. Then you have your Medicare Part B excess charges covered at 100% with a Plan G, okay? And of course, like we said before, your foreign travel emergency is also covered with Plan G up to 80%, and there are some limits when it comes to foreign travel. Alrighty, so let's talk about excess charges really quick. So this video is focused on Plan G. There is another plan that is called Plan N. Plan N does not cover excess charges, and there are some copays with Plan N as well. Now, the monthly premiums for Plan N will be cheaper than Plan G because of these copays. So you could pay up to $20 for a doctor visit and up to $50 for a ER visit under Plan N. But we're not talking about Plan N in this video. We're talking about Plan G. And let's talk about Plan G and excess charges. Like I said, Plan N does not cover excess charges. Plan G, however, covers excess charges. So what are excess charges? Excess charges is when a doctor can charge up to 15% more than what Medicare have set, right? The charges Medicare have set. If a doctor visit is $100, well, the doctor can charge more for that visit, and Plan G covers those excess charges. Now, I do want to say that most doctors don't charge excess charges, so it's not really a big deal, but it's nice to know that Plan G covers those excess charges. And it's also nice to know that Plan G does not have any copays like Plan N. So when it comes to copays, you don't have to worry about that at all when it comes to Plan G. Thank you so much for watching today's video. I hope you learned something new today. If you liked the video, please give it a like. And if you know anyone that needs this information, please share this video. If you have any questions, leave them in the comment section below and I'll be more than happy to answer your question. If you need any assistance, give our office a call. We'll be more than happy to assist you. At the end of today's video, there are 2 videos that you can also watch. Thank you so much for watching. Please subscribe to see me again, and I'll see you on the next video. Thanks for watching. Bye.